All right, let's cut through all the hype around artificial intelligence. We're not going to talk about some far-off futuristic concept today. Nope. This is a practical, hands-on guide for physicians, all about how you can use AI as a real-world tool to augment your practice, starting, like, right now. I want to start with a number, and it's a number that should really make every clinician pause: 34. 34 is the average number of hours per week your staff, and maybe you, are spending on just administrative tasks. Think about that. That's almost a full-time job doing work that has nothing to do with actually caring for patients. It's no wonder this is a massive driver of the burnout crisis so many of you are living through. And that number, 34, really gets to the heart of what we're calling the modern practice crisis. So many physicians and their teams feel like they're literally drowning in a sea of documentation, admin work, and just endless phone calls. Practices are losing patients because they can't even get to the phone, and the burnout rates, they're just staggering. This is the core problem that AI is, uniquely positioned to help us solve. And when you look at the actual data, it's pretty sobering. A staggering 82% of healthcare staff report feeling burned out. There's our 34 hours a week on admin right there in the middle. And check this out. Up to 30% of calls to a typical practice just go unanswered. And those aren't just missed calls, right? Those are patients who are now probably calling your competitor down the street. This way of working, it's just not sustainable.
Okay, but here is the good news. We're going to shift from the problem to the solution. I want you to start thinking of AI not as some kind of science fiction, but as a brand new toolkit, one that's filled with practical, specialized instruments that are available today to tackle these very specific pain points we just talked about.
So what's actually in this toolkit? Well, for starters, we're talking about voice AI that can automate your front desk, answering phones 24/7 so you never miss a patient call again. We've got ambient AI scribes that can literally listen to a patient encounter and draft your clinical notes for you automatically. There are even AI agents that can help manage your practice's performance and tackle the nightmare of insurance billing. And finally, some really powerful tools for getting evidence-based answers to your clinical questions right there at the point of care. Now, the engine running behind a lot of these amazing tools is something called generative AI. And put simply, it's a type of AI that doesn't just analyze data, it actually creates brand new novel content. It can write text, it can generate summaries, it can even draft referral letters for you, all based on the vast amounts of information it's learned from. Really understanding this is the key to using it effectively. And this slide right here brilliantly illustrates the two main flavors of AI you're going to encounter. I love this analogy. Think of a generalist AI like ChatGPT as a really smart, trainable med student. It knows a little bit about everything because it was trained on the whole internet, so it's awesome for things like admin tasks. But a specialist AI like OpenEvidence is more like a fellowship-trained specialist. It was trained only on peer-reviewed medical literature. The takeaway? You delegate different tasks to each. You wouldn't ask a med student for a final consult, and you wouldn't ask a world-renowned specialist to help you draft an email. So using these tools effectively really boils down to one critical skill: prompting. And look, prompt engineering sounds like a really fancy term, but it's just a new name for something great clinicians already do: intelligent delegation. In this new era, the best physicians are going to be the best delegators, not just to their staff, but to their AI assistants. You've got to know how to ask the right question to get the right answer. So how do you do it? Well, there's a simple, super memorable framework called RTFC. It stands for Role, Task, Format, and Context. First, you give the AI a role. Tell it who to be. Then, give it a very specific task. Next, define the format you want the answer in. And finally, you provide all the necessary context. This simple structure is what transforms a vague question into a precise, powerful instruction. Now, here's what most people do. They type in a weak, generic prompt like, "Tell me about heart failure," right? The AI has no role, no specific task, no defined format, and zero context about who the audience is. And what do you get back? A generic, unhelpful, massive wall of text. Pretty useless. But now, look at the difference when we apply that RTFC framework. It's night and day. We assign a role, act as a cardiology attending. The task is to explain pathophysiology using simple analogies. The implicit format is a simple explanation, and the context is crucial. It's for a medical student. A prompt this specific will give you a dramatically more targeted, useful, and frankly, brilliant response. This is the real key to unlocking the power of these tools. Of course, with a tool this powerful, especially in a clinical setting,
we have to talk about how to use it safely and ethically. This isn't just about getting great results, it's about protecting our patients and, frankly, protecting ourselves. We need to have crystal clear guardrails in place.
And the most important guardrail of all is what I call the two-tier AI stack. It's simple. Tier 1 is for anything that involves protected health information, or PHI. These tools absolutely must be HIPAA compliant and come with a business associate agreement, or a BAA. Tier 2 is for everything else, your general consumer tools like the public version of ChatGPT. And the rule is simple and absolute. Patient data only goes into Tier 1 tools. Never, ever, ever put PHI into a consumer AI.
So let's just boil this all down into 3 non-negotiable rules. Rule number 1, trust but verify. The AI is an incredibly smart assistant, but it's not the final expert. You are. Rule 2, we just said it, but it bears repeating, no PHI in consumer tools, period. And rule 3, and this is the big one, the clinician is always responsible. The buck stops with you. AI is a tool to augment your judgment, not replace it.
And that really brings us to the most important takeaway of this whole conversation. This isn't about replacing doctors. It has never been about that. It's about augmenting what you do best. It's about freeing you up to focus on what actually matters, taking care of your patients.
And the impact is very real and very tangible. We're talking about a potential 50 to 70% reduction in documentation time. For a private practice, that can translate into $80,000 to $100,000 in annual cost savings. This isn't just about efficiency. It's about reclaiming your most valuable resources, your time and your money, and putting them back toward better patient outcomes.
You know, there's that famous quote, often attributed to Charles Darwin, that just perfectly captures this moment in medicine. It's not the strongest or the smartest that survive. It's those most adaptable to change. And right now, AI represents maybe the single biggest change in healthcare since the invention of the electronic health record.
So look, AI isn't coming anymore, it's here. It's in our clinics and our hospitals right now. The doctors and the practices who embrace these tools to work smarter are the ones who are going to thrive in the coming years. And those who ignore this shift, well, they risk being left behind. So the only real question left is, how will you adapt?